Okay, thanks, Rob. Now we're going to look at practical applications to reduce the risk of viral spread. And as Rob talked about before, the main strategies to reduce the risk of viral spread is social distancing, hand hygiene, keeping hands away from your face, covering your mouth during coughing and sneezing, and sanitizing surfaces. So we're going to get into some examples of what that might look like. Next slide, please.
So let's go back to what social distancing looks like. You might want to increase the space between employees such that you're getting that 6 feet of division or 2 meters of division. And that may mean that you need to slow production down. In the case of the line assembly scenario, because certainly you don't want to have those folks up against each other. In terms of if you can't do that, you might want to use face coverings where distance isn't practical. And that could be in, because like I said, cases of slaughter facilities as well as meat fabrication. It sometimes isn't practical to have those individuals uh, spaced. And you could also think about adding partitions. I'm seeing that in our grocery stores. You could also think of other ways like encouraging non-contact uh, ways of communicating, like cell phones, walkie-talkies. But as I had mentioned, if you are using cell phones or walkie-talkies and they're shared commonly, you have to start thinking about putting those things on an escalated uh, uh, disinfection schedule. Other things that you might want to think about is admittance of customers. If you can, you can, if you are still engaging with customers, you can allow admittance of one customer at a time, and or you might think about moving to takeout and delivery scenarios. Next slide, please. Um, Rob talked a little bit about this face covering policy, and this is certainly we're pulling from the CDC. One of the things that we want to delineate against it is that we are talking about face coverings here and not respirators. We're still trying to spare the N95 respirators for healthcare. And as we know, at this point, the virus doesn't seem to be a risk in transmission in terms of food production. So really what we want to do is we want to spare those N95s for the healthcare, the higher risk operations, and utilize face coverings instead so that we can minimize the risk of spread to your employees. So face coverings should cover both your nose and your mouth. I have definitely seen on TV individuals who are wearing their face coverings in error, and you want to make sure that there's minimal gap between your face such that you are covering your entire nose and mouth. Again, this face covering is more to protect the wearer more to protect others in transmitting the virus, but it does affect and protect the wearer as well. But please remember that face coverings are meant to enhance your safety and not replace the other practices like social distancing and washing your hands. Next slide, please. In terms of face coverings, if you are going to use those, and it looks like more and more food production or food growers are using this, you want to have a policy in place such that you can tell your individuals how to use them, when they need to be changed, and here are some pointers in terms of that. You want to definitely make sure that if you're using disposable face coverings, please understand that they are meant for one-time use. So they're not something that can be used over and over again. And they should be changed when they become moist or soiled or damaged. And absolutely, in case of every mask, definitely want to observe proper hand hygiene after the mask is removed or changed. So when you take your mask off, it merits a hand wash. And when you're putting one back on, if there is a time lag in between that, taking it off and putting one back on, it also merits a hand wash. In terms of cloth face coverings, we do have a link on our resources, link to CDC, that provides great guidance on the use and fabrication of a cloth face covering. Um, in terms of laundering those, we do suggest that they get laundered daily and dry at the highest setting the material is going to allow. And you can also look under the FDA food code to get a clean linen directions on how to clean both face coverings as well as all your other laundering that you need to do, like gowns or towels. So one of the things that we are pretty confident about is that normal laundering, washing and drying of fabrics should reduce the risk of this virus being transmitted. So it is important that you put every cloth item that you have on a laundering schedule. Next slide, please. Um, every food safety professional will tell you that hand washing is so important, and this is not going to be any different. We are definitely going to advocate hand washing, hand washing, hand washing, and it is absolutely preferable where practical. And so we are suggesting setting up portable hand wash stations in fields as well as farmers markets if they're still doing some type of farmers market scenario. One of the things that I do want to point out here, though, is that most of our hand washing, when we are training food safety on point 3, when we are point 3, yeah, when we are scrubbing, the recommendation was 10 to 15 seconds. We have increased that, so it is now a 20-second scrub, and we really want to get into scrubbing those hands, getting into under your nails and between your fingers. So that's why the increase, we want to see an increase in time of scrubbing. And really that's the important thing, is the mechanical action of washing your hands and getting rid of the dirt as well as the virus is going to be important, as well as step 4, rinsing your hands. That mechanical action of rinsing is definitely going to be an important thing. Um, and we'll talk later about whether you have to have antibiotic soap or hot water, and the answer is no. This is really, you want to have appropriate soap for your task, and you want to have appropriate temperature of water for your task, but the mechanical action of scrubbing your hands is really where it's at, and that's where you need to focus. Yes, we are seeing a lot of hand sanitizer use. So if soap and water are not readily available, we are recommending an alcohol-based hand sanitizer. With alcohol, alcohol-based sanitizers, 60% is the alcohol percentage. You will see later under our disinfectant section, we go to 70% to disinfect surfaces with alcohol, but when we're at our hands, 60% is a good percentage for alcohol in hand sanitizers, because we want to do a good job on your hands in terms of disinfection, but we also don't want to increase it too much such that your hands become dry and difficult to clean because of all those nicks and crannies in your hands once they become dry. So 60% is a good percentage for hand sanitizer in terms of alcohol concentration. You want to rub those hands together until they feel dry. Again, it's really important to spread that alcohol around. That's why rubbing together is so important. Please remember that hand sanitizers are not effective for all microorganisms, like Rob was talking about. There are certain viruses, namely the norovirus, is something that is not susceptible to alcohol hand sanitizers. And so we are still advocating that hand washing is still the best if you can do that. And then also remember, hand sanitizer is not as effective if your hands are dirty. So if you're out working in harvesting or at a farmer's market where you are more susceptible to getting dirty hands, we are recommending um, that you set up a portable hand wash station so you can wash your hands. Next slide. So glove use, this is definitely going to be something else. We're going to use, a lot of people are using gloves. Um, and we're going to advocate for in certain instances where we do want to use gloves, and that especially is for ready to eat foods. You want to make sure that if it is something that is a customer can eat it without any other preparation or heat treatment, we want to make sure that like gloves can be used. You want to make sure that you are washing and drying your hands before you're putting those gloves on. And if possible, select the correct glove size. I realize this might be difficult as supplies dwindle, but certainly choosing the right glove is important, because if you wear too big a glove, you could absolutely cut that glove and it becomes part of your food. If you wear too small a glove, you can absolutely burst out of that glove, and that's not going to be good for it, for protecting your customers. Um, it's going to be important also to understand how to put that glove on. You don't want to, I know I see a lot of this out, and you never want to blow into the glove as you're putting it on. And you don't want to roll those gloves up. So it's very important to hold on to that edge of that glove and uh, slip your hand into it that way. Next slide, please. So when should you change your gloves? There's a few things I'm sure that you've already seen. You know, obviously, if you cough or sneeze into them, change the glove. If you're putting on or removing your face covering now, change your gloves. And certainly, as soon as they become dirty or torn, or before beginning a different task or after interruption. Um, One of the things that I really want to emphasize here is that I understand that gloves are going to be something that we are going to reduce. We're going to have a supply issue at times. So it is important that if you to understand that if you do something, a continued task for 4 hours, you can keep the same gloves. So it might be very important in terms of your operations where you are actually specializing in a position. So for instance, if you have either, if you're serving customers and also preparing food, it could be that there is going to be an individual who prepares the food and stays on that task. And if they are on the same task and there's no allergen issue, um, keeping your gloves and wearing those gloves for 4 hours, unless they become dirty or torn, is possible. It's going to be the issue that you're going to use more gloves if you switch on and off from task to task, where you go and you take money and move back to the other task of food preparation. And this is true even in food preparation, food safety preparation. Specializing in a task will help you save those gloves. One of the other things that we do want to recommend is and emphasize is you got to wash your hands after removing those gloves and changing into new gloves. It's very important that you're using clean hands to put on a new pair of clean gloves. All right, next. So we're going to talk a little bit about and this is something near and dear to my heart. If you're going to put new policies in place, new procedures in place, it's really important to have a written policy for that. And written policy will be an important way to communicate consistently with employees. You might have some turnover. You might have to replace employees because of illness. So it is really important to be consistent in your communication, and and written policy is going to be a good way of doing that. But you also want to tailor your communications to your audience, preferably in the languages of your employees. And in the case of low literacy, you may want to consider communications that use pictures. So it's important to tailor these policies so you are communicating effectively. Some of the policies that we think might be something you want to think about are the policy for social distancing, your policy for employee reporting illness, your illness policy of the company of what you're going to do if you do get an employee reporting ill. We are asking you consider update your leave policy. Again, these are interesting times that we're working in, and absolutely the food industry has got to keep afloat so we can maintain our infrastructure. So understanding that flexibility in your leave policy at this time might help employees be more cooperative in reporting their illnesses to you. Also, you think about policies for new cleaning and sanitizing chemicals. You might be starting to use new cleaning and sanitizing and disinfecting chemicals, and it is important to go over with your employees the safety and the policies of use of these chemicals. Next slide. So in terms of social distancing policy, some of the things that you might want to think about are you want to include both the work areas as well as the break areas. I could definitely envision that we got individuals who are in their work areas, they're distancing themselves apart, and then they take a break and they go to a picnic bench to have lunch. So it really is important that you are communicating to the employees about both work areas as well as break areas, and it might include resetting your seating in your break areas such that they are farther apart. You want to train employees as to what 6 feet looks like. I know that seems kind of simplistic, but it's important. It might be that you use markings. Like I said, when I go to a grocery store, I see tape. So I know where to stand, and I know clearly what 6 feet looks like. You can also look at landmarks as well as spacing tools like plexiglass shielding, those kind of things. You also want to train your employees working with customers on the policies of engagement, as well as communicate those policies with your consumers, with your customers. It's important to make them to have them understand what you're doing, what's important to keeping social distancing in your business. And actually it also, communicating those policies makes them feel better and safer about your business. Okay, next. In terms of employee illness reporting, and this is going to be really important. In food safety, we absolutely state that there has to be an illness reporting policy for your employees. And we understand that a lot of employees are working on an hourly wage, and reporting an illness might mean that they have to leave, have to be removed from the company, and sometimes leaving company means they're not getting paid. We completely understand that, but it is very important for them at this time to understand what's at stake if they don't report an illness. We do recommend monitoring state health departments as well as CDC for updates. And we do recommend that you educate your employees. Rob went through some of those symptoms of the illness. Educate them on those symptoms so they know what to look for. And again, this education should be in the language of your employees. And then also what to do if they suspect or they've been diagnosed with that illness. Who do they report to? How do they report this? And what do they report? And this should be confidential. I want to emphasize that this is still a confidential reporting. Names of individuals who are ill are not supposed to be reported. Next slide. In terms of company illness policy, again, you might want to convey that if possible, an augmentation to your leave policy, so there is some flexibility and individuals don't feel the pressure of maintaining their position on the job if they're ill. And then also you have to start considering if you're and you want to consider these things prior to folks becoming ill. You might have to fill positions due to absenteeism. Again, there's nothing from FDA or CDC that states that we want food businesses to close. We need food businesses to stay open so we can maintain that flow of food to customers. You guys are a huge part of the infrastructure. So putting a policy in place to determine what you are going to do when folks do become ill and you are experiencing some absenteeism. Consider cross-training. I know this is difficult, cross-training at 6 feet apart. I understand. So it is going to be something that it might be written information or understanding who might have been cross-trained prior to the pandemic. And then also consider employees out of work. There are definitely some individuals who are out of work and can definitely, there, especially a lot of food service workers who have food safety training and understand how to prepare food that could fill some of these positions. Again, we do recommend that training procedures should be written at this point in time. It allows you to communicate consistently to your employees what you expect each position to do. We always recommend this, but in this time, written procedures are going to be huge. There is a wellness check policy now that just came down through CDC yesterday, and they are recommending that individuals be well checked in terms of temperature, in terms of asking about symptoms. So it is recommended at this point by CDC to do so. And then also you want to identify resource support for your employees. Both physical and mental welfare of your employees during this time is very important, such that they feel safe and confident about working in the workplace. Go ahead. There is also a company you want to try to think about an illness policy, return to work policy. CDC has given some interim guidance on this. They are saying that if you haven't been tested, that you should exhibit no fever, unmedicated for at least 72 hours, no other symptoms, cough or shortness of breath, and at least 7 days have passed since the symptoms have abated. If you have been tested, they are saying that it should be, you can return to work with no fever, other symptoms, and 2 consecutive negative tests 24 hours apart. Next slide, please. One of the things you also want to do and have this ahead of time is what to do when someone identifies as ill. Again, this is not something you want to have, you want to put in play when someone becomes ill. You want to have this in play before that. But certainly what CDC is suggesting is you should send the employee home. Absolutely give the person contacts for local health department. You should already have those handy because you should be following the local health department. There is also and will be part of your resource guide. There are CDC guidelines entitled Steps to Help Prevent the Spread of COVID-19 if you are sick. And those are step-by-step guidelines. And we'll give you that link. You want to investigate the nature and scope of the exposure to your other employees and to your facility. You want to absolutely inform appropriate personnel and then take steps to protect the workplace. And again, we want to emphasize you don't want to reveal the name of the sick employee necessarily outside of your company. Next. In terms of, and again, CDC just came out with interim guidance in this. If you do have an individual that does report ill and you do believe it's due to the COVID-19 illness, then what they are saying is you want to look back amongst all your employees that may have contacted that employee within 48 hours. They do want then individuals who have been identified as being in contact with that sick individual to be monitored. And that includes wellness checks, temperature checks, and they are also recommending a face covering for those individuals, especially who have been identified as coming into contact with that individual within the last 48 hours. They're not stipulating that any individual that comes in contact with someone ill has to go home. CDC is rather saying monitor these individuals to determine if they're going to be, if they're ill, and keep monitoring them. That is I want to emphasize that. It is important, though, if you have identified an individual, that you have a written, again, question and answer sheet that asks certain questions that you can track the employee work location, the ill employee's work hours, their work duties, so you know what rooms or parts of the facility or they've come in contact with. And how much did they move around in your facility? And then also just a date and time of when the employee did report the illness. Again, we are recommending that this is a written questionnaire sheet that you can fill out when an individual calls you or contacts you. Right here, let's pause in terms of questions. Before we get into cleaning and sanitizing. So one of the questions is, do we recommend washing gloves? If they are the single-use gloves, we're not going to recommend that you wash gloves, more that you put in place a strategy to such that they can wear those gloves more. If you're going to get into a scenario of washing gloves, it's going to be something where you want to get a more heavy-duty glove that can be used for food use, that you can wash. But with single-use disposable gloves, we're not going to recommend that. We're also not going to necessarily recommend sanitizing those as well. I've heard a lot of folks who are talking about dipping single-use gloves, disposable gloves in sanitizer solutions. Some of these gloves just can't handle that aren't compatible with those solutions, and they can actually degrade the glove. So really what we're recommending is streamlining and putting together a way such that individuals can use their gloves and stay on task with their gloves.
Joel, we had a question come in earlier about the SurSafe recommended requirements for 50 to 100 parts per million. Do you think that's enough?
And we're going to talk about this more when we get to cleaning and sanitizing. That's enough for sanitizing, but it's not enough for disinfecting. And so we're going to talk about the differences there. So that's the answer right now. And if I don't answer your question more as we get through this cleaning and sanitizing and disinfecting, I'll certainly go through that again.
Joelle, should people who are harvesting produce be wearing masks?
You know, I don't know if that's not, I think that could be a good idea if they're very close to each other. And what we're doing again is we're wearing those masks to prevent the spread of those who are close to each other. But again, one of the things I want to reiterate is that using masks is not replacing that good hand hygiene, that good sanitation practices that we already have put in place in terms of food safety. And so that's really hand washing, not touching your face, making sure that you're using cleaning and sanitizing if you're in the packing house. Those are the things that are going to absolutely help reduce the transmission to equipment and to the food. And then maybe, yes, face masks if you are in close contact, more than 6 feet, for sure. Wearing those face coverings to help stop transmission from person to person and keep your employees safe. I do also see another question. Is there a recommendation if you do not have a dryer? Again, that's a good question. I think, we definitely would like to see it a dryer with the highest setting. I think that's, again, a little bit an increase in safety, but it's really the washing that is going to be the thing that's most important. Actually washing it and making sure that you are removing the virus from the fabric and it's rinsing away in the wash machine. So if you have to hang them to dry, hang them in a safe place where they won't get recontaminated, and they should be good. But I think that, like I said, the dryer is just an added safety step. Are we good? Question monitors. I want to make
We're
sure.
good. We'll get the rest of them at the end.
Thank you. So let's move on to cleaning, sanitizing, and disinfecting.